Now we'd like to start Keynote Lecture 2. The first speaker is Honorary Chair of Japan Medical Association, Dr. Yoshitake Yokokura. He is going to talk about the current situations and measures against COVID-19 infection from the perspective of One Health. Good afternoon, ladies and gentlemen. For 8 years until 2020, I served as the president of Japan Medical Association, and I'm now allowed to have a title of honorary chair of JMA for the first time. And today I'm going to talk about the current situations and measures against COVID-19 infection from the perspective of One Health. And I'd like to thank those members of Fukuoka Japan Veterinary Medical Associations and Japan Medical Associations to organize such a wonderful forum for health today. I began to think about the concept of One Health for the first time, mostly at the General Assembly of World Medical Association in 2012 in Bangkok. World Medical Association, World Veterinary Medical Associations, so physicians, veterinarians got together, and we start to discuss that such collaboration is becoming more and more important. And in 2013, Dr. Kurauchi, the president, became the president of Japan Veterinary Medical Association, and he proposed that we can have agreement on academic exchange between JMA and JVMA. And in all the 47 prefectures in Japan, we called for the expansion of this promotion. And this agreement includes the academic information sharing for the development of human and veterinary medical care, and academic information required by both shall be mutually provided as much as possible. And when signing this agreement, there's a quite powerful approach from JVMA, especially from the leadership of Dr. Kurauchi. And as mentioned earlier, in 2015 in Fukuoka, the second global conference was held. At the time, Fukuoka Memorandum was declared, and JMA and JVMA academic exchange agreement was the basis of words in Fukuoka Memorandum. Now, when it comes to the COVID-19 infection, as mentioned earlier, excuse me, my slide is not proceeding. Thank you. So COVID-19 infection, and this coronavirus is derived from animals, and through some intermediate animals, it comes to the transmission to the human beings. And as shown here in this picture, the bats are considered to be the source of this coronavirus. And in case of SARS virus, the palm civet seems to be the cause. And in case of MERS, the Arabian camels are considered to be the intermediate hosts before reaching the human beings. And with regard to the SARS-CoV-2 virus, we haven't elucidated all the source animals yet. And this is from the website of Professor Yoshikawa, the Okayama Science University. And the SARS virus seemed to come from greater horseshoe bat through palm civet, and leading to the outbreak in human beings in 2003. In case of MERS, it comes from the pipistrelle bats and through Arabian camels. In case of COVID-19, it seemed to come from a type of bats and with intermediate host and then reaching to the human beings. Now, SARS-CoV-2 virus is studied in molecular epidemiology. It seemed to start in city of Wuhan in China. So Wuhan-derived virus seemed to enter Japan around January, February last year, and it disappeared. And in March or April, the European strain start to appear simultaneously in different locations in Japan because there were people traveling a lot around that time, especially those college students who traveled abroad before graduations. And this strains seem to expand, and that was the first wave. And this first wave mostly start to disappear, but partly that infection continued in Tokyo area. And starting from mid-June, this cluster surfaced seemingly suddenly. Probably the tracing before that was not easy. So genetic analysis of virus, we need to study this quite in detail. Currently, we are hearing about the mutation strains from Spain, and currently South African mutation strain is being an issue of concern. So it's very important to continue such investigatory efforts. And the national institutions of infectious disease does this kind of job. As Dr. Kayano discussed earlier, if you look at the number of cases in the world, we see high numbers in Americas and Europe and others. Fortunately, in Northern Eastern Asia, where we belong, we don't see so many cases. But if you look at the number of cases in different countries, it shows US, India, Brazil, and UK. These countries have a quite large number of cases. And currently in UK, France, Germany, they are still having the lockdown. Japan seems to have lower numbers among industrial nations, but compared to China and other countries in Northeastern Asia, our number is not lower. And this shows the number of cases in top 10 countries and China and Japan. And this is as of December last year, where the number of cases didn't reach 100 million yet. Now, these are the data from Japan. First case was detected in 16th of January from a person who traveled in China, and in December, or rather the February, we start to see an increase of cases who went to a snow festival in Sapporo in Hokkaido. Back then, what kind of disease this was and what kind of virus this was, we didn't know much about this yet. So we are quite nervous, and we thought emergency state declaration would be necessary. And on the 7th of April last year, the first emergency state declaration was issued by the government of Japan. And in May, the number of cases in Japan decreased significantly. And in the meantime, the contagious nature of virus and the seriousness of the disease, we came to understand it gradually, and we had a second wave of infection in around summertime, and the winter season came before the second wave subsided completely. And naturally, in cold season, virus becoming more active, and that's where we are now. And from 7th of January, we are under the second emergency state. Now, if you look at the ages of those confirmed cases, the majority belong to younger generations, in those in 20s, 30s, or 40s. So younger people, how they prevent transmission or infection will be an important key. On the other hand, those with serious conditions or those dying from the disease belong to older generation. What kind of symptoms do they mostly have? Fever, cough, breathlessness. 70% of patients have either of these symptoms. So symptoms such as fever, cough, breath shortness, it's very important. Actually, several days before the onset of these symptoms, you can transmit your virus to other people. That's very scary nature of this virus. You don't think you are ill, but you are carrying the virus, and you can transmit it to the others. Now, 10 days after the onset of disease, your virus is not so active to be transmitted to others. But even after 10 days of the onset of the disease, some of the patients become seriously ill. Among those who were tested positive in PCR test, 45% had no symptoms, and 32% had no symptoms at the time of testing and developed some symptoms later, and 23% had symptoms. So those asymptomatic patients, how they can restrain themselves in their activities is very important. At one time, was said that younger people develop no symptoms, so they don't need to worry about this disease. But recently, we came to know that those younger people could have sequelae or continuing symptoms. So it's very important to try not to have this disease even for younger generation. On the other hand, COVID-19 could have a significant negative impact on economic activities, as seen in various economic indicators. This shows the employment, and the number of employees decreased significantly in June, July, especially in those part-time workers, in female workers. They tend to lose job because of COVID-19, and there should be a sufficient support for that. If you look at the different industries, especially in the hotel or the restaurant services or other services, they tend to lose jobs. On the other hand, in healthcare and welfare, more people are needed in these factors. So we should have a mechanism to help people to change their jobs easily.
With economic depression and unemployment, we have seen an increase in the number of suicides. Number of suicides exceeded 30,000 in 1998 after the bubble economy burst, but it went down to 20,000 or so from 2012. But in 2020 July, we have started to see an increase in the number of suicides. And we expect more than 20,000 to have killed themselves by the end of 2020. We need to have responses or countermeasures against this as well. Prevention of infection and sustaining the economic activity. How can we balance both? This is the big question. If there is a high level of infections, we need to regulate and control the economic activities to make sure that the spread is controlled. And once the spread is well controlled, then we need to activate the economic activities. We need to think about both at the same time to strike the right balance all the time. Last fall, when the second wave was over, the subcommittee on COVID-19 came up with a 5-point action plan. They have identified where clusters tend to occur: restaurants for entertainment, non-Japanese community, schools, and also workplace. These locations need to be closely looked at, and convincing information has to be disseminated so that the people understand the importance of prevention. In order to control the infection, industry-wise guideline has to be implemented, and also they want to increase the initiative to resume the visitors from outside of Japan, but now this is tightly controlled once again. It's also important to analyze the genetic aspect to verify the effectiveness of the countermeasures as well. Now, droplets from the mouth and nose is a major cause of the infection of the virus. And therefore, these droplets need to be prevented or controlled. And if everybody can participate, then we can prevent the spread of the disease. So crowded place, close contact, and closed spaces need to be avoided. These are the 3 C's. Once you come home from outside, always wash your hands, ventilate the room, do not talk loud, and also maintain social distancing. These are all important measures against COVID-19. And there are 5 different scenes where the risk of infection increases. For example, parties, including drinking and eating. In Fukuoka, for example, from the end of December to January, the number of cases increased rapidly, mostly explained by the time of around Christmas and end of the year, parties where people ate and drank together. This is a very likely a scenario behind the increase of the number of cases. And also, eating or drinking over a long time in a big group is a bad idea. Conversation without face covering is also a bad idea. And close quarters living situations is also bad. When you take a break from your work and go to a small smoking room, you tend to remove your face covering as well. So again, these are risky scenarios that we need to pay attention to. Hand washing has to be done thoroughly by every individual. And by doing so, we should be able to control the spread of COVID-19 infections, which in turn means that the normal social activities and economic activities can return. It is very important for all the individuals to pay close attention. With regard to prevention of infection as well as the health management at work, shift work, and also working from home can be used to avoid people from working in close or closed areas. And the airing of the workspace as well as EHS management is very important for prevention of infection. Using Fugaku supercomputer, COVID-19 infection was investigated in terms of how effective the face coverings are, the masks are. By using the face covering, we know that the volume of virus inhaled would reduce dramatically. If you suspect that you have been infected, and if you wear a face mask, you would be able to minimize the risk of infecting others. We now know the important role that face masks play. However, face coverings do not really prevent the infection 100%. So using the face mask as well as avoiding the 3 C's is very important. And changing the air of the room is very important as well. Droplet infection is the main route, but also droplet nuclei. In other words, this is a situation that is close to airborne infection. This is known to occur, so windows should be opened maybe more than twice an hour. This is a recommendation. Avoiding infection, of course, is important, but even after being infected, the body's immunity, if it's strong enough, can deal with a small volume of virus. In order to heighten the immunity or immune capability, it is very important to take care of yourself every day. Exercise, sleep well, have enough nutrition, have a bath, warm yourself up, and laugh out loud in order not to be stressed. These are all effective ways of heightening your immunity. Food is also important. 5 different types of food to help with immunity. Rather than white rice, eat brown rice or rice with germs. Take fibers, seaweed and mushrooms, and try to eat small fish like dried fish that you can eat as a whole. Try to eat fermented food as well. In Japan, we have fermented bean paste and fermented beans, and eat colorful vegetables as well. And if you suspect that you may have been infected, speak to your family doctor, Kakaritsuke, and then testing can be done using PCR or antigen testing methods for different purposes, and also antibody testing. Usually PCR and antigen testing are used to check for infection. And if you're infected, there are various treatments for COVID-19 being developed. In the initial phase of infection, antiviral agents should be taken to minimize the replication of virus, and in the latter phase, you should use medication that would treat the inflammation. And the vaccination will start in February in this country as well. So we are really hoping that we can deal with the situation through these measures. When do we see the end of COVID-19? Well, through the efforts of every person in Japan. Well, the virus has been developed, and we do have some treatments available as well. Every single person need to pay utmost attention to the control and prevention of this infection. Thank you very much for your kind attention.
Thank you very much, Dr. Yokokura. Next, we'd like to have Dr. Isao Kurauchi, President of Japan Veterinary Medical Association. Dr. Kurauchi's speech title is Future Prospects for One Health, based on the spread of COVID-19 infection. Thank you. I'm Kurauchi, the President of Japan Veterinary Medical Association. We have this symposium, or rather international forum, held in Fukuoka, and Asian Veterinary Medical Congress is held in Fukuoka. So I do like to express my gratitude for this onset. And the COVID-19, those people working in the prefectural offices are working so hard against this challenge, and taking this opportunity, I'd like to thank them for their daily efforts. Now, today I'm going to talk about the future prospects for One Health based on the spread of COVID-19 infection. One Health was mentioned and discussed by previous speakers, and the health of people, health of animal is one, and this is indeed related to the establishment of a safe society and related to the sustainable development goals. And this is related to the prevention of natural disaster. One Health has 6 pillars. One is about the zoonosis, and the next is AMR, protection of the environment, and the coexistence of humans and animals, and the better relations among human, animals, and environment. And these are 6 pillars in One Health concept. Now, one of the pillars is about the zoonotic infections, meaning these infections transmitted from people to animals or animals to people. Such infection is called zoonotic infection. There are about 1,400 pathogens that affect human beings, and among 60% of them are zoonotic. And these pathogens include not only bacteria but also viruses and other microbes. Virus is the smallest one among them, and the virus is the origin of the word means toxin in Latin. there are about 600,000 viruses that may affect human beings, and there are unknown viruses more than 320,000, and there are more than 540,000 viruses in the wildlife, and in Japan also there are about 60 of them. Anthrax and other disease viruses may be used in bioterrorism too. Now, with regard to the COVID-19 infection, as mentioned by Dr. Yokokura, this is one of the zoonoses. As with MERS and SARS, this SARS-CoV-2 virus belongs to coronavirus and leading to the serious pneumonia or death, and it can lead to outbreak. SARS-CoV-2 spreaded so broadly because it's highly contagious, and there are quite high number of carriers with mild symptoms. They continue their activities in broad areas to spread the virus. For us veterinarians or veterinary medical society, what kind of roles do we have for the prevention of such infection? WHO said the original host of SARS-CoV-2 is a bat, and it reached human beings through intermediate host. There are three principles for prevention of infections. One is measure against the source of infection, and second is against the carriers, and the third is for the hosts. Now, when it comes to COVID-19, source of infection is bat, and the carriers are pangolin, and the hosts are human beings or companion animals. Now, for us JVMAs or veterinarians, our roles are so important in identification of source animals or blocking the carriers or the strengthening the resistance of hosts. And the veterinary medicine or veterinarians playing the major role in elucidation of the emergence mechanism of the virus. And pigs are the animals of highest concern because the gene exchange can occur between human type and avian type in pigs. So we veterinarians are in a position of capture human health and animal health in an all-inclusive manner. I said that the new virus may occur in pigs. Human virus cannot affect birds, and birds virus cannot affect humans, but their virus can infect pigs, where these two different viruses merge to create new virus. That's the case of Spanish flu more than 100 years ago. In the past, Japan Veterinary Medical Association have had efforts in the area of One Health. In 1993, in Germany, the World Veterinary Medical Association meeting was held, and they sent declaration with regard to the safety of food. And in 2004, the New York meeting was held for Manhattan Principle. Mutually, the human environment and the animal environment are related to each other, and the effort is needed to prevent the infections. So that's at Manhattan, New York, more than 10 years ago. In 2010, JVMA adopted the activity guidance saying animal health and people health is one, and that's the wish of Earth. In 2013, for the enhancement of global health, the veterinarians and the medical associations issued the memorandum of understanding, and JMA and JVMA signed an agreement on collaboration on 2013, and in 2050 in Madrid, WMA WVA meeting was held. And in 2018, Japan and Korea signed an agreement. And in 2022, Asia Veterinary Association Fukuoka meeting is to be held.
On the left, you can see the picture of when we signed the scientific academic agreement with JMA. And to the right, you can see the One Health International meeting held in Spain. And myself and Dr. Yokokura are presenting. The first One Health International meeting held in Spain was participated by 130 people from 140 different countries. 2011 disaster and Fukushima nuclear accident and post-incident collaboration among doctors was the title of Dr. Yokokura's presentation, and I spoke about the outlook of the veterinarians in the similar context. And the second meeting was held in Kitakyushu City. 31 countries and 639 people participated, and Fukuoka Memorandum was declared. This is FAVA, Federation of Asian Veterinarian Association meeting. This is the council meeting. Asian region and also Oceanian region are covered by FAVA. In other words, Australia and some other countries are part of this 22-country organization. FAVA meetings have been held over many years, and in 2022, a FAVA meeting will be held in Fukuoka. Now, the Horse Racing Association and our organization collaborated to invite Asian veterinarians to Japan, and we cover the research cost, travel cost, and event participation cost. We have this type of project, and this project was explained at this council meeting of FAVA. And that's the photograph. Fukuoka Prefectural Assembly approved the ordinance for One Health promotion, and this was already enacted on 18th of December. Eliminating drunk driving and also protecting the victims of sexual assaults. These are some of the past ordinances that have been passed by the Assembly, and this time the One Health ordinance was proposed and approved. Our philosophy was clearly written in the second chapter, and the responsibilities of the municipal governments as well as the citizens are clearly stated. And One Health to be promoted within education, and also One Health Center or the hub for promoting One Health should be established. These are some of the wordings of the ordinance. Health and life of Fukuoka Prefecture people need to be protected against biohazards, biodisasters. And this ordinance is going to be a strong backbone to serve and protect the citizens. I'm hoping that this will spread to different prefectures throughout Japan. I talked about the 6 pillars of One Health, which is shown by this diagram. Education is the first piece. Education board and also primary as well as junior and senior high schools are part of this. The second pillar is research. This is university, medical school, veterinary school, and also pharmacology schools. Research will be conducted with the various academia organizations. JMA, JVMA, and also the Nurse Association, HCPs, will exchange information and implement measures against infectious diseases. And that way we can build a healthy prefecture. And the fourth pillar is agriculture, forestry, and food. So forestry office, and also forest-related testing labs, as well as food testing laboratories, will be part of this. It's important to protect the health of the people, but as Yokokura mentioned, it really depends on how healthy the food is that we take. So the livestock and also the agricultural produce need to be healthy. In other words, our food needs to be produced where we can see how it is being produced. So we are trying to do a local production, local consumption, and also educate people on healthy eating habits. Then we have the community or the friends. Fukuoka Prefecture already has great friends in this endeavor. COVID-19 treatment is being developed by a company, and this company is doing research in Kurume and also collaborating with the Fukuoka Prefecture. They're using a research center in Fukuoka too, and we are expecting great results coming out of this initiative soon. It's BONAC, and it's a private corporation invested by the Fukuoka government, so that they can do joint research. This is a great situation, and it can lead to so many different potentials. But the only authorized products will be used, and we are hoping that they'll be successful. Milk from Fukuoka Prefecture and other produce from different parts of this region can be further nurtured through this friendship or collaboration. Although not listed on the slide, we also need to develop and nurture private sector organizations, including volunteer organizations, and we already have a volunteer organization for One Health. In 2022, further Congress will be held in Fukuoka at the Hilton Fukuoka Seahawk. In 1978, in Manila, in the Philippines, the first meeting was held. And in 1995, in Yokohama, we did have a further meeting in Japan. And since then, it's been 27 years. And we'll be holding this Congress in 2022 in Fukuoka. And I really hope that the Fukuoka Prefecture, Fukuoka City, and all the relevant stakeholders will support us with this Congress. What is happening at the national level, central government level right now? Animal-related law or act need to be established. Looking at COVID-19, the source was bats, and carrier was also another type of animal. And the host includes animals. Source of infection, bats. Bats are wild animals, And also, ASF, again, the source is a wild boar. And the source of infection need to be surveilled, but there is no law supervising or overlooking the surveillance of such animals. In 1951, there was a law that was enacted, which is a Domestic Animal Infection Disease Control Act. So 1951, this is 2 years before I was born. It's a very old act. At that time, environment, energy, and also wildlife were never the main topic. And that is why people thought that they only had to take care of the domestic animals or livestock when they wrote this law. But now we know that the source of infection can be wildlife, wild animals, causing such big pandemic. So these wild animals are the carriers, and the virus or the bacteria carried by these animals are transmitted to the livestock. And once the livestock is infected, this act can be enforceable. But we cannot do anything before that. So learning from the experience of COVID-19, I'm really hoping that the surveillance of pets and wild animals will be somehow written into law. And again, I hope that Fukuoka provincial government will speak to the central government to promote this idea. Our movement is mid to long term. Our activities are mid to long term. Right now, the main focus is to end the COVID-19 pandemic. And I know that all the governments are working together toward this goal. In terms of human infection, there is a law for prevention of infectious diseases. Once people are infected, we can apply this law, and the MHLW would get involved, and the HCPs will play certain roles to help. But now we know that wild animals are the hosts, the cause of these unknown infectious diseases, which may infect us any time in the future. We don't know when. We have gaps in our legal system right now, which need to be filled. In the Fukuoka Memorandum, we have identified some important items. This is one way of preventing infections. For example, for JVMA, we believe that this is our mission. The theme has to be researched, information needs to be shared, and medical devices need to be stockpiled. Prediction, simulation has to be done in case the infection happens. And these are some of the actions that need to be taken, and they are captured in Fukuoka Memorandum. In 2016, the memorandum written and announced, and it was also provided to the central government. But unfortunately, it was not really applied to this COVID-19 pandemic situation. It's very unfortunate. As I mentioned in the beginning, zoonosis is a type of disaster. WHO classifies the natural disasters into three: climate-related, geological-related, and then biological-related. And zoonosis is a biological disaster, as you could clearly see in the case of COVID-19. In order to prevent such disaster, we have a very important memorandum called the Fukuoka Memorandum. We need to make certain that the Fukuoka Memorandum will be widely accepted in order to prevent future infectious diseases. Our ancestors, our forefathers, our parents have passed down the earth to us. But the global environment is facing big problems right now. If we do not preserve this environment, there is no future for the human being. We are already seeing various problematic phenomena. Our role is to make certain that the earth that has been passed on from the past generation will be made healthier and then given to the next generation, to our children and grandchildren. And this is the reason we need to promote One Health. And I believe that Fukuoka City is the origin of One Health here, and JVMA and JMA share the same understanding and awareness. I truly hope that through this forum, we can really deliver this strong message of One Health to the rest of the prefecture, rest of the country, and the whole world. I would like to thank again the Fukuoka Prefecture and also all the stakeholders who made this wonderful forum possible today. Thank you very much for your kind attention.
Thank you very much, Dr. Kurauchi. Now, we'd like to have a short break for preparation, and we are going to resume the session at 3:20 to continue keynote lecture session. Thank you. Thank you very much for waiting. We'd like to resume the keynote lecture session. From now on, we'd like to have Dr. Yokokura, Dr. Kurauchi, who just gave lectures, to discuss further from the recognition of One Health concept to implementation. This session is moderated by Dr. Hiroaki Shiraishi, the technical officer at the Fukuoka Prefecture, the health care services, and which is also supported by Dr. Kazuhiko Imamura, the Fukuoka Veterinary Medical Association. Thank you very much. I'm Shiraishi, who serves as the moderator of this session to have a discussion with Dr. Yokokura and Dr. Kurauchi. And I'm Imamura, who also serves as the support of moderation. I belong to a Fukuoka Veterinary Medical Association. Earlier, very suggestive lectures were given by Dr. Yokokura, Dr. Kurauchi on the concept of One Health. Now, in the concept of One Health, collaboration between physicians, veterinarians are so important under this COVID-19 challenges. Now, back in 2013, when JMA and JVMA signed the agreement on academic exchanges on One Health, so the two organizations start to work for the concept of One Health rather early stage, and that led to the collaborations we see today. Now, back in 2013, why did you lead to a decision to promote the One Health concept between the two organizations? Dr. Yokokura first. importance of One Health. That was around the end of 20th century and the beginning of 21st century. There were various infectious diseases between humans and animal species. One was the BSE, starting from UK. And that was a very difficult disease with dementia-like symptoms. And there was SARS starting to appear at the beginning of the century. And also, we had a novel influenza or various new types of influenza, which were more contagious and more virulent, and many of them were arriving through pigs or birds. So we came to understand that we need to have some measures against zoonosis. 0157 infection was active in 2005, and for us at the JMA, we established Office for Infectious Disease Control for the purpose of crisis management. So in that scope, in 2012, from WVA to WMA, academic exchange was proposed. That was at the Congress held in Bangkok. I was attending a WMA meeting held in Bangkok, and that was a quite wonderful offer or proposal from WVA, and I thought we should do similarly in Japan too. And back then, Dr. Kurauchi became the president of JVMA, and both of us are from Fukuoka area, and our hometowns next to each other, and that was a good opportunity. Thank you very much. Now, from the viewpoint of JVMA, Dr. Kurauchi, how was the case? Well, as just mentioned by Dr. Yokokura, Dr. Yokokura and Dr. Kurauchi had a good relationships between ourselves, and that facilitated all the moves. At university, I studied viruses, and my professor said that viruses are toxic, but they are not our enemies. Viruses had a very important role in the evolution of human beings, and the viruses are the powers to continue to change the world. Still, it is very important to learn about the virus diseases and the measures against them. So that's how I studied virology. After graduation, I started work, and I was interested in environmental issues. And I started to work in the forestry, the planting trees, and also when I became the president of Fukuoka Veterinary Medical Association, I proposed to start the activity for natural protection. And there are a type of wild cats residing only in Kyushu area, and we started the campaign to protect this species then some years ago. Back then, the government of Japan was going to establish a law to protect domestic species. In order to stop the foreign species in Tsushima or Iriomete areas, for wildcats living there, we human beings are the foreign species. That's what I said when I was invited to speak at the diet meeting. And then I became a board member of our association, and there was a high level of concern about the human flu. And together with medical association members, we learned about the measures against flu. Now, so I had a chance to learn about the concept of One Health also, and when I met the Dr. Yokokura, because both of us are the president of each professional organization, and both of us belong to Fukuoka, and that was a very good, rare and good opportunity. So I said, why don't we work for the One Health concept, take this opportunity? And the Yokokura agreed. So that's how One Health move started. Thank you very much. Indeed, you had a very foreseeable for the future. And in 2015, WBA, WMA had a global conference on One Health in Madrid, and both of you gave a lecture there. For the first time, we made an announcement or statement from Japan, and you had a standing ovation from the audience at that time. This global conference was the first global meeting on One Health, and this global conference or about the One Health concept, how did you feel about that? May I ask Dr. Kurauchi first?
WHMA to JVMA, the invitation was sent for this meeting. And I responded by saying, yes, we would definitely love to join. And then I was asked to do a presentation. I hesitated, but in the end, I decided to accept. And I listened to the leaders of WVMA and asked them, why did you invite us? And they said, this is the only situation in the world where the Medical Association and the Veterinary Association are working so closely together by signing an agreement and trying to address the One Health challenge. And this is why we are inviting you to speak on behalf of JVMA. Now, I explained this to Dr. Yokokura, and Dr. Yokokura kindly also accepted to do a presentation at this meeting. I spoke about the disaster in Tohoku area. Researchers and academicians throughout the world have strong interest for Japan and Japanese culture. And I spoke about the Japanese disaster earthquake, which was also a topic of interest for them. And the Tohoku Bureau of the Ministry of Land and Transport was headed by somebody I knew. And the Ministry of Land and Transport had some video of the disaster that happened in Tohoku area, and I asked if it's okay to use the video, and they kindly accepted. And this is a type of video that you would not have seen through common media. Really horrific images of the disaster. I think it made a strong impression. I spoke in Hakata dialect, and Dr. Yokokura actually spoke in fluent English. And maybe that was the reason there was a standing ovation in the end. Dr. Yokokura, can I ask you the same question? Dr. Kurauchi spoke with a very strong dialect, and that is why there was a standing ovation, I think. It was a wonderful presentation. Main theme was drivers of One Health. Strengthening the collaboration between physicians and veterinarians was the main theme of this Congress. And we spoke about the East Japan disaster in 2011 and ensuing medical support and also support by veterinarians. And we spoke one after the other at this Congress. We still had the problem of a Fukushima nuclear accident, and the people were very interested in that as well. So we spoke about that aspect of the disaster as well. This was the first global conference, and I strongly felt that Japanese people have great access to healthcare, universal healthcare, and that really is one of the reasons why people in Japan have good well-being. Spain also has a very good health system, not as good as Japan, but very good. So when I spoke with Spanish doctors, we talked about the similarities between the two countries in terms of the healthcare systems. And this conference was something that left a strong impression in my memory. And Dr. Kurauchi gave such a dynamic presentation with the video. I have a very vivid memory of this conference. Presentations by the two doctors, of course, helped the following movement on One Health. I'm sure of that. Dr. Imamura, do you have anything? The two doctors are the drivers of One Health in Japan, and they took center stage in Madrid, and immediately after that, in 2016, One Health international meeting was held, as reported so many times. The second meeting was held in Fukuoka, Kitakyushu City, thanks to the support by Doctors Yokokura and Kurauchi. I was part of that event, and very important discussions and presentations were given. And Fukuoka Memorandum was announced and stated as a message to the world. And I believe this was a very important milestone in the history of the movement for One Health. Fukuoka Memorandum, what does it signify for you? I want to ask this question to both of you. What is your opinion on Fukuoka Memorandum? I'll start with Dr. Yokokura. The second international symposium was held in Fukuoka Prefecture, and this is completely due to the effort made by Dr. Kurauchi and support of Fukuoka City. It was an excellent event. It was participated by more than 50 countries, And One Health is a health for both people and animals. But as a foundation, we need to have a healthy global environment. If you think about COVID-19, we can see the same situation. As a species, now there are too many people, and we are developing areas that belong to wildlife. And we are exposed to new pathogens, new infectious diseases. Importance of maintaining the global environment is the foundation of One Health. Kitakyushu suffered from severe air pollution in the past. And the Kitakyushu city did address this problem over time, and there was an exhibit at this conference with regard to the history of improvement of air quality. And I was speaking to a representative of Indian Medical Association, and this representative said that India is struggling with air pollution right now, and they would like to learn from the experience of improvement of air quality by or in Kitakyushu. And they did have some programs or meetings related to that afterwards. In order to protect the health of the people and animals, we really need to improve the environment. That was another point that was emphasized at this meeting. And also Prince and Princess Akshino also came and joined the ceremony. The imperial royal family members are also interested in the protection of the environment. That's something we learned. For the Fukuoka prefecture, I believe this event was very impactful. And Dr. Kurauchi was the instigator. He suggested that this meeting be held in Fukuoka. And thanks to your his strong leadership, we could follow and organize this event. Thank you. Health promotion and environmental protection. Sometimes it's difficult for us to connect these two dots. But as Dr. Yokokura mentioned, in the second international conference, there was a strong message linking the environment and health. Dr. Kurauchi, toward the end of his presentation today, said that we have to pass down or pass on the earth to the next generation in a healthy manner. Now, Dr. Kurauchi, what kind of significance do you think Fukuoka Memorandum holds?
At the first global conference, JMA and JVMA had a very favorable applaud. And then in short while, why don't you have a second global conference? And we quickly said yes. And usually it takes 2-3 years to have a global conference like that. And how could we have a global conference organizing in Japan? And usually such a big meeting would require support from a local prefecture, and such meetings are usually held in Tokyo, Yokohama, and major cities in Japan. And we contacted them, but we were not likely to have good support from such local governments. And I said to Dr. Yokokura that why don't we have this meeting in Fukuoka, and why not, he said. And Fukuoka prefecture worked so nicely for us. And today we have members of Fukuoka local government attending this meeting. And at the executive committee meeting, they joined the discussion. And at the Operational Congress, Fukuoka prefectures showed their capabilities, and they spent them. They provided a funding, but also at the reception they provided the local produce of Fukuoka in high quality, and the guests from all over the world were very happy to enjoy them. So such a good global meeting was held in Fukuoka Prefecture. Initially, we thought of Fukuoka City as a venue, but the Fukuoka City was so busy and most of the venues were booked already. And for some reason, the Kitakyushu city has a vacant venue for the Congress, and they wanted to host this conference, and that's how we decided to have this global meeting in Kitakyushu city. The title of memorandum, Fukuoka Memorandum, I didn't have at the day one of the meeting, and because many people say that the Fukuoka conference was so nice, and I came to think that how come we could retain the name of Fukuoka, and I thought of the Potsdam Declaration, and at the time of another global conference, I was a part of that, and at the host of Habitat, the very beginning of the meetings, the many times the name of the countries which is not known to many people were announced many times, and I asked about it, and I was told that that was for the purpose of helping people to remember the name of those unknown countries. And I thought it's wonderful. And why don't we have a name of Fukuoka in the name of memorandum, so that the people can memorize the name of Fukuoka, and that was a good return to Fukuoka too. In the activities of One Health, name Fukuoka will appear and again, and as with Manhattan's declarations, we put together this memorandum for the implementation of the concept. So starting from Fukuoka Prefecture, Memorandum of Fukuoka was announced, and we have to promote this concept among the residents of Fukuoka Prefecture and children in Fukuoka Prefecture, because it is our responsibility. So in that sense, Fukuoka Memorandum is so important to us. Thank you. As both of you say, with this memorandum, Fukuoka One Health is now upgraded to the implementation stage. In Fukuoka Prefecture, in the effort against COVID-19 infection, various activities and efforts are being made by different organizations, and among them, as mentioned earlier, we have Fukuoka Prefecture's basic ordinance on promotion of One Health, which was approved December last year. In One Health, the measures against infectious disease and measures against AMR are considered important. Not only those, but also others are captured in this local ordinance. So once again, if I may talk about this ordinance, could you please describe how you see this local ordinance and its significance? Dr. Kurauchi first. Well, local ordinance is usually proposed by the administrative sections or by the local prefecture assembly, and the establishment of such ordinance requires quite significant human network and support. And this ordinance became possible because of the support of Fukuoka Prefecture. There have been 4 ordinances of this kind, and this is a very rare and important examples. And in the second article, it says the importance of constitution, and in the third it says the responsibility of local residents, and the fourth the responsibility of prefecture, and in the fifth it says the responsibility of physicians and veterinarians. As we discussed earlier, all the 6 pillars of One Health are captured in this. In Article 7 and 8, researchers and research organizations and collaboration among them are described. In here, especially with this local ordinance, I would say that the Fukuoka Prefecture is to rebuild the health-related research institute so that it can answer the needs of health-related efforts. The only domestic animal testing facility is available to do the checking or testing of this kind in Fukuoka Prefecture. And I hope the testing of not only domestic animals but also the companion animals should be possible. One Health Center is indeed will be the important foundation in Fukuoka Prefecture to promote the concept of One Health. So I believe that this is one of the very successful early examples of local governments ahead of other prefectures in Japan. So when we have this One Health Center, and when it's included in a school education, then that will be quite important to pass down the healthy earth to next generations in the future. When we have infectious disease, it is said that the infectious disease can be a driver to move the world for next generation. For example, Spanish flu. After the onset of this pandemic, several years after that, the basis of United Nations started. So in this particular case of COVID-19, and when we apply this to Fukuoka Prefecture, by overcoming this challenge of COVID-19, Fukuoka Prefecture can move to a next new stage.
So very timely. It's very important to put this in practice in a concrete manner. I understand. Dr. Yokokura? I think it is a wonderful ordinance. And my gratitude goes to all those involved, including the parliamentarians. And this ordinance includes the idea of creating a hub and also zoonosis countermeasures hub. With the COVID-19 pandemic, I wonder, from the end of 20th century to the beginning of the 21st century, why are we seeing so many new emerging infections? Well, one is expanding population and also global warming and more frequent mutations of viruses due to global warming. This means that research is very important and we need research centers. One health hub or center being established in Fukuoka means that Japan can have such center for the future, and this center or hub can serve as the hub for the whole Asian region because Fukuoka is so close to the other Asian countries. Many of the emerging infections tend to come from Asian countries, including China. So R&D Center, as well as Countermeasure Center, Human Resource Development Center, this kind of hub creation or center creation is included in the ordinance. And for the future of Fukuoka, this is a wonderful suggestion. Thank you. Dr. Imamura, do you have anything else? We have just covered the idea included in the ordinance, creating centers. This is very important. The government has tasked the Veterinarian Association to explain One Health to the citizens of this region in an easy to understand manner. So how do we inform the people of the prefecture and people in Japan? How do we communicate One Health? What would be the good approach to communicate and explain and make them understand One Health? Dr. Yokokura? In order for us to make sure that the younger generation, including children, understand One Health, which is really important, One Health meaning think about not just people's health but also animals' health as well. I think back at what was happening in my childhood. Compared to the time of my childhood, more households, more families have companion animals, pets at home. And we can take advantage of that situation and provide opportunities for education. Veterinarians take care of these household pets, and they can work closely with JMA. School doctors, well, we have many members who serve as school doctors. So educating those doctors on One Health is also important, I think. Thank you. Dr. Kurauchi? People in the prefecture and throughout Japan should understand One Health better. And One Health promoting ordinance in Fukuoka Prefecture has to be implemented without fail so that the Fukuoka Prefecture can be the model for the rest of Japan, so that we can implement similar ordinances in all the 47 prefectures in Japan. I think that's very important. As we try to educate people in Fukuoka, I think we need to develop and nurture private sector organizations. What we have learned from COVID-19 is that when we have an unknown virus without treatment, it's very scary, it's very threatening. And I know that healthcare workers are really working hard to deal with this, but also within families, within communities, countermeasures against infectious diseases need to be implemented. And in that sense, One Health is extremely important, and we need to educate people on that. Our One Health ordinance in Fukuoka Prefecture is going to play a major role in this effort. That's what I believe. Thank you. Based on the opinion received, the prefectural government will make efforts to communicate One Health to the citizens. Now, with regard to COVID-19 pandemic, we have learned a great deal from both of you today. We need to beat this disease and think about what would happen in the post-corona era. And many experts have spoken about the post-corona, post-COVID-19 era. How do you both see in the era after COVID-19, specifically in terms of what will happen to One Health? Dr. Kurauchi? Human evolution and the social revolution can be driven by this type of a big pandemic. COVID-19 is a big issue. We are struggling, but also it gives us an opportunity to create a new society through this experience. We need to make certain that we evolve as a human being and a society. For example, Fukuoka Prefecture has one of the best producers in Japan and in the world, but if we want to export to other countries, we have to comply to Japanese specific standards. But we have to really think about sustainability globally going forward. So the agricultural produce or fishery produce maybe should be certified based on One Health standard as the products get exported to other countries. Within Fukuoka Prefecture, we really have to see some progress, including FONAC. We need to develop more private sector companies as well. That's one aspect that we need to think about. Speaking about post-COVID-19, actually Fukuoka Prefecture Veterinary Medical Association produced this leaflet about One Health, and there is a very clear statement printed on this. The 6 pillars of One Health are explained on this brochure. So with Corona and post-COVID-19, Fukuoka Prefecture should take really advantage of this kind of material and put the idea into practice. Dr. Yokokura, as I mentioned before, human population is increasing, and we have the issue of a global warming, which means that there is a good possibility that we will see more new infections emerging. After overcoming COVID-19, we have to get ready for the next upcoming infectious disease. There are 3 factors for the infection to be established. One is the nature of the pathogen. With COVID-19, well, it may be another coronavirus or maybe another type of virus. And the second aspect is the route of infection. With COVID-19, it's mostly droplets, saliva. So how to prevent the droplet infection is the focus of people's efforts. We need to educate people on how to protect themselves against infection as well. And we need to have a set of rules and awareness that people can follow to protect themselves against any kind of infection. And also, above all, we need to enhance the immunity of the individuals. The immune protection is very powerful, as I mentioned in my presentation. It is very important to pay attention, close attention, to our day-to-day practice, how we lead our daily lives. And we need to create a society where people can adhere to these ideas of protecting themselves by improving immunity. COVID-19 may turn out to be the beginning of the new battle between human and virus. We may see something more severe in the future. For example, highly virulent virus like Ebola again appearing in the future. That's entirely possible. So in order to be ready, we need to learn from this experience, COVID-19, and heighten the awareness of the individuals to protect themselves.
Thank you very much. We would like to ask many more questions, but time passed so quickly. Based on the lectures given earlier, Dr. Yokokura and Dr. Kurauchi provided very important opinions on this topic, and I'd like to thank once again Dr. Yokokura and Dr. Kurauchi for attending this session despite their busy schedule. Thank you very much. With this, we close this keynote lecture session. Thank you very much. With this, we close all the speech sessions of the forum. Now, we'd like to have a vice chair of the Executive Committee on One Health International Forum 2021 in Fukuoka, Dr. Haruo Kusaba, the president of Fukuoka JBMA, to give closing remarks. Thank you very much. I am Kusaba from Fukuoka Veterinary Medical Association. Thank you very much. I'd like to thank all the speakers today, Dr. Kayano and Dr. Yokokura, Dr. Kurauchi, and all the viewers who joined the program through web streaming. And also, I'd like to thank the people in Fukuoka Prefecture government who helped this event possible. I'm sure today's event will bring quite fruitful results, and through the health of humans and animals, as well as the preservation of environment, we would like to promote the One Health even further. And with this, we are going to close One Health International Forum 2021 in Fukuoka.